Well, hello, good evening, you guys. So glad to be back. I actually got accepted into the UNCW Accelerated program for my master's in nursing education last year, and I've had some difficult issues dealing with COVID, so I've had to withdraw. But I'm so glad to be back and hopefully get back on track. So I'm here in the accelerated program for nursing education, and I chose nursing education because I love to teach, especially my community, more in the church setting, my community, and also in staff development at my in my secular arena, staff development in the hospital. So I've done a lot of work with my hospitals with establishing policies and procedures for utilization management. I'm no longer at bedside. I've been doing case management for probably since 2007, and I've switched from case management back to utilization management. And so that's what I'm currently doing between utilization management and an appeals nurse for a small private hospital right now. But I did choose nursing education because I do love to teach. I've had history in teaching fundamentals to first year nursing students. I've done that, and I've also taught a CNA class also one semester. So I love to teach, love to do clinicals, but I think I'm leaning more towards staff development at this point with education, because I've seen a sharp, a really, because of the turnover with nurses, I've seen a sharp learning curve that's needed there. So I'm actually in staff development. um, the other question is, what do you hope to be doing with a degree? So, like I said, the hospital setting versus I want to do a lot of work in our community, especially the African American community, dealing with blood pressure, kidney failure, and how those affect. I think sometimes they don't correlate how having high blood pressure and not managing that actually kills your kidneys. It causes other problems, and then having been coupled with diabetes, it's really those chronic illnesses, and they seem to spiral down from there. So I want to do a lot of teaching in the community about things that we think lay people may already know, but they may not. So that's what I want to really hone in on. Also, in my patient care, I actually started out as a LPN. I was an LPN, and then I worked in nursing homes. I did some stuff in with developmental disabled patients who were geriatric DD. And I did that for a little while. I was the nurse manager for a home. I did that as an LPN. I went back to school, got my ADN, and I worked in some skilled nursing facilities. I transitioned to telemetry once I got my ADN. And then after that, I went into dialysis. I really loved working in outpatient and inpatient dialysis. Worked as a hemodialysis nurse coordinator for a small hospital, which had a very small dialysis unit until it was contracted out to DaVita. And so I did that for a while. Then I went back to school at Winston-Salem State University, got my bachelor's degree. While I was getting my bachelor's degree, I was the resource nurse at Forsyth, and I covered emergency department, the cardiac diabetic unit, the palliative care unit, pulmonary unit. I was all over the place, so I got a lot of good bedside experience there. So I did get my bachelor's there. I did traveling for a little while, and I took a travel nurse assignment in the dialysis unit at Duke University Medical Center, and I stayed there, seeing these nurses walking around in regular clothes, and was just wondering, what are they doing? And so that's what piqued my interest in case management. And so I did do case management. I transitioned to case management for a little while, worked in the medical ICU at Duke, covered abdominal transplant. I also covered, what else did I cover? Pulmonary. think I covered pulmonary for a little while. And then I transitioned to utilization management, and I've been doing that and denials since then. I've also worked at UNC Hospital, and I just recently resigned from there so I could go back to school. And I'm currently working from home for a small private hospital, working as a denial specialist, appeals nurse. I'm writing a lot of appeals letters, trying to get insurance companies to pay for patient stays. We're seeing a lot of denials, especially with Humana and United Healthcare. And so I'm the person that tries to get those cases overturned, set up peer-to-peers and that type thing. So that's what I'm currently doing right now. In the video, was it the Blake nursing video? The Blake video. After watching that, which was very funny, by the way, I think I'm more of the clinical instructor who is a supporter. Not too much of a micromanager, especially if you've already done checkoffs. Not too much of a peeker or the spy. I can't say that I'm that person either. I think I'm more of a supporter. When it does come to me having to crack down, I can do that and pull you out if need be. But I think I would be more of the supporter type clinical instructor. And I think I have answered all those questions. I wish everybody a wonderful 7 weeks, and I look forward to working with you guys. Thank you, and y'all have a great evening. All right, I'll talk to you soon. Bye-bye.